I'm George Valiotis, the Executive Director of the European Health Management Association. We've had a great day today talking about startups in the European Union and how they can impact into the healthcare system. EHMA, where I work, is very interested in the role of startups because we see health systems management as being relevant to all of the stakeholders. So everyone from the doctors to the citizens to patients and to decision makers. We wanted to bring them all together today so that we can start to build a common language and learn from each other on what more can be done to make the environment better for citizens by enabling innovators to be doing their job their best. Some of the key themes that came out were looking at the ecosystem of all of the stakeholders, how we collaborate together. We're very interested in regulation, making regulation effective but simpler to navigate. Lots of licensing questions came up. Funding models, of course, are a key issue, how we can make funding more accessible in different shapes. So looking at joint funding, the ways that different directorates could work together differently to co-fund things. So similarly, we want to see at the decision-making level people coming together, but also at the development and innovation level people coming together as well. So from this, we're going to do a lot more thinking, and we'll be generating a report that brings together all of the key issues that I've loosely touched on just now. And so keep watching this space to see what more comes out of these great discussions today.
Hi, my name is Melike. I'm working with Allied for Startups and I'm the Digital Health Fellow. We've been co-organizing this event with my colleagues at EHMA, and it's been a great first part of the event. So today we brought together startups with the rest of the healthcare ecosystem, including the industry and organizations, etc. And it's been a very active discussion, and we're also not surprised to hear that the main result of the discussions from each group has been that collaboration is the most important thing that's necessary within the healthcare ecosystem in the EU.
My name is Nils Dessin. I work for MSD here in Brussels, and we are very happy to be associated to this event that is organized by EHMA and Allied for Startups. For us as a pharmaceutical company, we see digital transformation as something that is not just about improving what we actually do, but also in collaboration with all players in the healthcare system to see how we can better improve the health of citizens. And this is why it was very interesting in being part of the session that we had as part of the workshop on collaboration, because what appeared to me as very important is that it's not just about helping startups in developing their solutions, making sure that they can validate also as well what they are doing, and making sure that at the end of the day the solution will help clinicians or patients, but also how we can better equip the whole ecosystem to fully grasp the potential of digital health. And so what we realized that it's really an exercise where everyone needs to have a say, and there are different mechanisms that can be put in place both at EU level but also in the countries. So very happy to be part of today's event.
Hi, I'm Hans Niels. I'm the co-founder and CEO of Biteflies. We work on wearables in healthcare, so basically we want to get people out of the hospital, monitor them at home, to be able to monitor them better, get them on right diagnosis faster, get them on right medication faster, and go to prevention and prediction in the future. For us, it's very important to be part of this event because we want to make solutions for patients that help patients that have an impact there, and that we fight barriers that we have to overcome. Regulation is not necessarily easy, it's not necessarily transparent, and it's something we have to tackle. On the other hand, we look at the market, which is not necessarily easy as well. But my main takeaway is, and what we try to do with Biteflies as well, just jump in the pool, start making solutions, go to patients, go to hospitals, work together with different stakeholders, and while we're doing it, we show we can have impact, then we can actually make a difference and scale afterwards as well.
Hi, my name is Ángel Martín. I work for Johnson Johnson as Director of Government Affairs in medical devices. And actually, I'm very proud of being here. Johnson Johnson is one of the supporters for this event between EHMA and Allied for Startups. Actually, one of the reasons why we support this is because we strongly believe in the value and the strength of startups in evolving the digital health ecosystem. And actually, it's kind of the reason it's well rooted in the company. We claim to be a 130-year-old startup, but actually it's because we value the power of these companies actually to bring breakthrough innovation into the healthcare ecosystem. And as such, we actually believe it's really, really important to provide them support. And we actually channel that through basically an organization that we call J-Labs. And J-Labs is basically an open innovation ecosystem where startups can come and get access to resources, to experts, to a network, to coaching, also to funding, to basically advance in their ideas and create and generate more value. And something that really came up during the event today is actually how we can all work together to unlock some of the barriers, whether they are regulatory barriers, technical barriers like interoperability, even sometimes some social barriers. And collaboration at all levels between all different types of stakeholders came out as a very clear conclusion from the event. So that's something that we are really very proud of, being part of this process, being part of the discussion, and we're looking forward to future collaboration. Thank you.
So I'm Annamaria Hl. I come from Helsinki, Finland. I've been here for today to have a very fruitful discussions on how startups can work efficiently with all the stakeholders in all over the EU in the healthcare and medtech areas. I have very nice discussions, understanding on how collaboration between different stakeholders is actually going to be the key to everything, and we need to have a common mission to do things which are best for the patient. So that should be all the motivation between all the and behind all the stakeholders, and we got very nice discussions in this day on that topic.
Hello, I'm Ion Gheorghe Petrovai from Fresh Blood Health Tech Community in Transylvania, Romania, and I'm here to contribute with the new approach and with a new vision of supporting healthcare startup. It's important to have the bottom-up innovation which is brought by the startups meeting with the top-down support and strategy in order to change healthcare for the good, influence our lives, and actually make a difference important for all of us.
My name is Dro Funk. I'm founder of Tired of Cancer. We're based in the Netherlands. We provide a self-management tool for cancer patients who suffer from fatigue. I am here today to get involved into the European system and to improve healthcare, the digital healthcare. I like to meet other startups. I like to meet patient groups and other participants and stakeholders, because we need each other to bring this further.
Hi, I'm Beth from Brain Plus. We are a digital therapeutics startup in Copenhagen, Denmark. Our platform is used for brain rehabilitation and also the early detection and treatment of onset of dementia and Alzheimer's. The reason that we are here today and really benefited out of the workshop was the ability to discuss amongst different partners within this whole ecosystem on the issues that we do face as the startups. I think really important for us out of our discussion was the ability for us within the GDPR and the medical device regulations to be able to have more openness and clarity about what exactly these regulations are. How should we adhere to them? What is the work that we need to do from our perspective as a startup to then get certified within the different regulations that exist? And how can we then comply with different regulations such as the GDPR? Currently, we are faced as a startup with the amount of resources, the amount of knowledge, also the local regulations in each country when within these overreaching EU initiatives, and we need to really understand better what we can do as a startup to be able to survive, but also how can the EU look at us and understand what are the challenges within the resources in order for us to then, or that are keeping us back from innovation.